Well, once a market leader, healthcare is stumbling this year. According to the Wall Street Journal, the sector is lagging the broader market after being the best performing group in the S&P 500 last year. So let's shine the sector spotlight on healthcare. We're joined by Brian Tanquilut. He's the healthcare services analyst over at Jefferies. Brian, welcome. Nice to have you here.
Hey, thanks. Good evening.
So what do you think is behind this? I mean, frequently we see when one sector has a good year, the next year it slows down a little bit. But is there more to it than that?
You know, that's a very good question. If you take a look at the performance of healthcare over the last 5 years, it's actually outperformed pretty well over that period. But I think this year, what we're seeing is the early signs or early entry of overhangs from the upcoming elections in 2020. So normally we see, the election discussion come up 12 months to 14 months before the elections. Now we're seeing it about 18 to 20 months, a little earlier than usual. So I think that's what's weighing on most of the healthcare sector today.
We've also had a lot of activity in the healthcare sector. We've had a lot of mergers and acquisitions. We have insurance companies buying some of the pharmacy benefit managers. How much of that has kind of kept investors a little off guard?
I think that's a good point. On one hand, you've got, like you said, the pharmacy benefit managers are now owned essentially by the insurance companies, right? Cigna and Express Scripts, Aetna and CVS, United and Optum. So as we see more pressure on drug pricing or more scrutiny in Congress on drug pricing in general, and the PBMs have always been in the spotlight on that issue. Now that target basically has shifted to the insurance companies. Now, the other thing I would say is, as we've seen some of these deals, the question gets asked, why are they doing these transformational transactions, or why are they doing these big deals that are kind of out of left field? Like, are they seeing something that's scaring these management teams? So I think investors are looking into these transactions as potential signs of trouble or concern from the industry itself.
Are there parts of the industry, though, that you are more bullish on than others? And if so, which ones? Yeah,
so as we think about Medicare for all and the elections and all these things, right, the areas that I'm really bullish on are home nursing. So you've got names such as Amedisys and LHC Group, and also the clinical lab space. And the reason I'm bullish on these two sectors is that we're continuing to see a shift from expensive building-based settings to care delivery is moving more to the home and outside of hospitals. And then on the lab side, the market is expanding. Market share is moving to Quest and LabCorp, the two big names in the space. So I think you're going to see a growth acceleration in those two names over the next few years.
All right, Brian, thanks so much, as always.
Thank you, Sue.
Brian Tanquilut, and he is with Jefferies.